Are you approaching your 60s, thinking you have plenty of time to worry about serious health screenings later? What if I told you that there's a critical window between ages 60 and 70 when 4 specific medical tests could literally save your life, but after age 70, these same tests become so dangerous they could actually shorten your lifespan? This isn't fear-mongering, it's medical reality that most doctors won't explain clearly, because they assume you'll just follow their recommendations without understanding the crucial timing involved. I'm Dr. Eleanor Grace Whitford, and I've spent the last 18 years specializing in preventive and longevity medicine for patients over 50. During my research at Stanford and my clinical practice, I've discovered something that fundamentally changed how I approach health screening for my patients. There's a golden decade between 60 and 70 when your body is still resilient enough to handle intensive diagnostic procedures and benefit from early detection, but strong enough to tolerate the treatments that might be necessary. After 70, this equation completely reverses. The same tests that could save your life at 65 become fraught with complications and risks that often outweigh their benefits. Yet most Americans wait too long, missing this crucial window when early detection and intervention could add decades of healthy living to their lives. If you're finding this information valuable, please give this video a like to help other people in their 60s understand this critical timing before it's too late. Let me share with you the story of Richard, a 68-year-old retired teacher who came to my office last year for what he thought would be a routine physical. He'd been putting off comprehensive health screenings for years, always finding excuses to delay. "I feel fine," he said. "I'll get around to those tests eventually." But Richard had reached that critical age where eventually needed to become immediately. When we completed his full screening panel, we discovered stage 2 colon cancer, elevated PSA levels indicating possible prostate involvement, and cardiac stress test results showing significant blockages that could have caused a massive heart attack within months. Here's what made Richard's story remarkable. At 68, his body was still strong enough to handle aggressive treatment. We caught everything early enough for successful intervention. Today, 2 years later, Richard is cancer-free, his heart function is excellent, and he's more active than he's been in decades. But if Richard had waited until 75 to get these same tests, the story would have been tragically different. The treatments would have been too harsh for his older body, the cancer would have been more advanced, and the cardiac interventions would have carried life-threatening risks. Research from the American Preventive Medicine Institute shows that comprehensive health screening between ages 60 and 70 can extend healthy lifespan by an average of 12 to 15 years, but the same screenings after 70 often lead to complications that reduce quality of life and longevity. Test 1. Complete colonoscopy. Screening, your last best chance. The first crucial test you must get before age 70 is a complete colonoscopy screening, and this might be your last opportunity to benefit from this life-saving procedure. After 70, the risks of colonoscopy complications increase dramatically, but between 60 and 70, this test remains one of the most effective cancer prevention tools available. Here's why the timing is so critical. Colon cancer develops slowly, typically taking 10 to 15 years to progress from small polyps to dangerous tumors. If you get screened at 65 and we find and remove polyps, we've prevented cancer that would have threatened your life in your late 70s or 80s. But if you wait until 75 to get your first screening, we might find advanced cancer that's much harder to treat. Martha, a 64-year-old patient of mine, had been avoiding colonoscopy for years because she'd heard horror stories about the preparation and procedure. When we finally convinced her to get screened, we found 12 precancerous polyps that were removed during the procedure. If she had waited another decade, those polyps would almost certainly have become aggressive cancers. The colonoscopy procedure involves examining your entire colon with a flexible camera while you're under sedation. The preparation requires dietary changes and bowel cleansing solutions, but between ages 60 and 70, your body handles this process much better than it will later. Your cardiovascular system is still robust enough to handle the sedation safely, and your tissues heal quickly from any polyp removal. What makes colonoscopy so valuable during this age window is that it's both diagnostic and therapeutic. Not only can we detect problems, but we can remove precancerous polyps immediately, preventing cancer before it starts. This is true prevention, not just early detection. The statistics are compelling. Colonoscopy screening between ages 60 and 70 reduces colon cancer risk by 90% and colon cancer death by 95%. But after 70, complication rates from the procedure itself begin to outweigh these benefits, especially if you've had normal previous screenings. Research from Johns Hopkins found that people who get their first colonoscopy between 60 and 65 have the best outcomes, with minimal complications and maximum cancer prevention. Those who wait until after 70 for their first screening face significantly higher risks of bowel perforation, cardiovascular complications from sedation, and dangerous dehydration from the preparation process. To prepare for your colonoscopy, follow your doctor's preparation instructions exactly. The quality of the preparation directly affects the quality of the examination. Stay well hydrated during prep and arrange for someone to drive you home after the procedure. Recovery is typically quick and uncomplicated when done during this optimal age window. Test 2. Comprehensive PSA and prostate assessment for men. For men approaching their 60s, comprehensive prostate screening, including PSA testing, digital rectal examination, and possibly MRI imaging, represents a crucial opportunity to detect and treat prostate cancer while treatment is still highly effective and well tolerated. The controversy around PSA testing stems from overscreening of men over 70, where the slow-growing nature of most prostate cancers means treatment often causes more harm than benefit. But for men in their 60s, particularly those with family history or other risk factors, prostate screening can be life-saving. Let me tell you about David, a 62-year-old businessman who came for his annual physical. His PSA was elevated at 6.2, concerning but not extremely high. We followed up with additional testing, including a specialized MRI and targeted biopsy. We found aggressive prostate cancer that would have been fatal if left untreated. Because David was 62, his body was strong enough to handle definitive treatment. He chose robotic surgery, recovered quickly, and today has undetectable PSA levels and excellent quality of life. If he had waited until 75 to get screened and found the same cancer, the treatment options would have been much more limited and carried significantly higher risks. The key to effective prostate screening in your 60s is comprehensive assessment, not just a simple PSA blood test. We use PSA trends over time, family history, digital examination findings, and sometimes advanced imaging to make informed decisions about whether further testing is needed. Modern prostate cancer treatment for men in their 60s has excellent outcomes. Robotic surgery, focused radiation, and other advanced treatments are well tolerated and highly effective when cancer is caught early. The cure rates for prostate cancer detected and treated between ages 60 and 70 exceed 95%. But timing matters enormously. Prostate cancer typically takes 10 to 15 years to become life-threatening. Cancer detected at 65 and successfully treated means decades of healthy life ahead. The same cancer detected at 78 presents a much more complex treatment decision because the risks of aggressive treatment might outweigh the benefits. For men with family history of prostate cancer, African American heritage, or other risk factors, baseline screening should begin even earlier, around age 55 to 60. The goal is to establish your normal PSA level and watch for concerning changes while your body is still young enough to benefit from treatment if needed. The comprehensive prostate assessment includes PSA blood testing, digital rectal examination, review of urinary symptoms, and discussion of family history. If abnormalities are found, additional testing might include specialized MRI, genetic testing, or targeted biopsy using advanced imaging guidance. Test 3. Advanced cardiac stress testing, detecting silent heart disease. The third crucial test for people in their 60s is comprehensive cardiac stress testing, especially if you have risk factors like diabetes, high blood pressure, family history of heart disease, or if you're planning to increase your activity level in retirement. Heart disease is often silent until it causes a major event like heart attack or sudden cardiac death. Between ages 60 and 70, stress testing can detect significant coronary artery blockages, while your heart is still strong enough to benefit from interventions like angioplasty or bypass surgery. Susan, a 66-year-old retired nurse, felt perfectly fine but had diabetes and high blood pressure. Her stress test revealed severe blockages in 2 major coronary arteries. Because we caught this before she had symptoms, we were able to perform preventive angioplasty that likely saved her from a massive heart attack. The stress test involves exercising on a treadmill or stationary bike while your heart rhythm and blood pressure are monitored. If you can't exercise adequately, we can use medications to stress your heart pharmacologically. We're looking for evidence that parts of your heart aren't getting adequate blood flow during stress, which indicates significant coronary artery blockages. What makes stress testing particularly valuable in your 60s is that your heart is still resilient enough to handle both the test itself and any treatments that might be recommended. After 70, stress testing becomes riskier because the test can trigger heart attacks in vulnerable patients, and the treatment options become more limited. Advanced cardiac imaging, including nuclear stress tests or stress echocardiograms, can provide detailed information about your heart function and blood flow. These tests can detect problems before they cause symptoms, when treatment is most effective and least risky. The goal isn't to find problems to treat aggressively, but to identify significant issues while your body can still benefit from intervention. A 65-year-old with severe coronary disease can undergo bypass surgery with excellent outcomes and return to full activity. The same surgery at 78 carries much higher risks and often doesn't restore the same level of function. Research shows that people who have cardiac screening in their 60s and receive appropriate interventions live longer, have fewer heart attacks, and maintain better quality of life compared to those who wait until symptoms develop or until they're older and less able to tolerate treatment. If stress testing reveals problems, treatment options for people in their 60s include lifestyle modifications, medications, angioplasty with stents, or bypass surgery. All of these options are well tolerated and highly effective when implemented during this optimal age window. Test 4. Full Body Cancer Screening Panel, your comprehensive safety net. The fourth crucial screening involves comprehensive cancer detection testing that goes beyond routine screening to look for multiple types of cancer, while your body is still resilient enough to handle aggressive treatment if needed. This isn't about expensive full-body scans of questionable value, but rather evidence-based screening for the cancers that most commonly affect people in their 60s and 70s. Lung cancer for current or former smokers, breast cancer for women, cervical cancer for women who haven't completed screening, skin cancer for everyone, and blood cancers that can develop silently. Advanced screening technology now allows us to detect many cancers at extremely early stages when treatment is most effective and least traumatic. Between ages 60 and 70, your body can handle intensive treatments like chemotherapy, radiation, and surgery much better than it will later. Linda, a 63-year-old former smoker, came for comprehensive screening. Her chest CT scan revealed a small lung nodule that proved to be early-stage lung cancer. Because we caught it at stage 1, she needed only minimally invasive surgery and is cancer-free today. If that same cancer had been detected 5 years later, the treatment would have been much more extensive and the outcomes less certain. For current or former smokers, low-dose CT screening of the lungs between ages 60 and 70 can detect lung cancer at curable stages. Lung cancer is the leading cause of cancer death, but when caught early through screening, cure rates exceed 85%. Advanced mammography and breast MRI for women can detect breast cancers that are too small to feel, but still early enough for excellent treatment outcomes. Genetic testing for BRCA mutations and other hereditary cancer syndromes can guide enhanced screening and prevention strategies. Comprehensive skin examination by a dermatologist can detect melanoma and other skin cancers at early, highly curable stages. Skin cancer rates increase dramatically with age, but early detection makes treatment simple and effective. Blood testing for tumor markers and genetic analysis can sometimes detect blood cancers or other malignancies before they cause symptoms. While not perfect, these tests are improving rapidly and can be valuable components of comprehensive screening. The key principle is that cancer treatment is most successful when the patient is healthy enough to tolerate aggressive therapy. A 65-year-old diagnosed with early-stage cancer can often undergo definitive treatment and return to normal life. The same person at 78 might not be strong enough for optimal treatment. Have you been putting off comprehensive health screening because you feel fine and don't want to find problems? Please share your thoughts in the comments below, because understanding what prevents people from getting timely screening helps me address these concerns more effectively. Natural Health Solution, the Pre-Screening Vitality Protocol. Before we discuss the optimal timing for these crucial tests, I want to share a natural health protocol that can help prepare your body for comprehensive screening and ensure you're in the best possible condition to benefit from early detection and treatment. This vitality-boosting protocol involves 3 key components designed to optimize your cardiovascular health, immune function, and overall resilience during this critical screening period. First, implement a pre-screening exercise program that includes 30 minutes of moderate cardiovascular activity 5 days per week, such as brisk walking, swimming, or cycling. This strengthens your heart and lungs, making stress testing safer and more accurate while improving your ability to tolerate procedures and treatments if needed. Second, adopt an anti-inflammatory nutrition plan focusing on foods rich in antioxidants and omega-3 fatty acids. Include fatty fish like salmon twice weekly, colorful vegetables and fruits daily, nuts and seeds for healthy fats, and minimize processed foods that can interfere with accurate test results. Third, ensure optimal hydration and electrolyte balance by drinking half your body weight in ounces of water daily, adding a pinch of high-quality sea salt to maintain proper mineral balance, and avoiding excessive caffeine or alcohol that can affect cardiovascular function during testing. This protocol should be implemented for at least 6 weeks before your comprehensive screening appointments. Many of my patients report feeling more energetic and confident approaching their health screenings when they've prepared their bodies optimally. Now, if you're serious about taking control of your health during this crucial decade and want access to detailed screening schedules and preparation protocols, I want to invite you to become a member of our channel. Members get exclusive access to comprehensive health screening guides, preparation checklists for each test, and priority responses to health questions. Click the join button to start optimizing your health before it's too late. As we conclude our exploration of these 4 crucial tests, I want you to understand something profound about aging and health screening. There's a narrow window of opportunity between your 60s and early 70s, when your body is still resilient enough to benefit from aggressive screening and treatment, but old enough that serious health issues are beginning to develop. Miss this window, and you face a terrible dilemma. Accept screening tests that carry high risks of complications, or avoid screening and risk missing treatable conditions. But catch problems during this golden decade, and you can often prevent or cure diseases that would otherwise shorten your life. In my 18 years of practice, I've seen this pattern repeatedly. Patients who get comprehensive screening in their 60s and address problems early often enjoy active, healthy lives well into their 80s and 90s. Those who wait too long either suffer complications from late-stage treatments or live with preventable diseases. The 4 tests we've discussed today represent your best opportunity to detect and prevent the health problems that most commonly affect people in their 70s and 80s. Colon cancer, prostate cancer, heart disease, and other malignancies can often be prevented or cured when caught during this optimal screening window. Remember Richard, whose story I shared at the beginning. His comprehensive screening at 68 revealed 3 serious conditions that could have been fatal. Because we caught them early and his body was strong enough for treatment, he's now healthier at 70 than he was at 65. That's the power of optimal timing in health screening. The excuses I hear most often from patients in their 60s are, "I feel fine, I don't want to find problems, I'll deal with it later," or "I'm too busy right now." But feeling fine doesn't mean problems aren't developing silently. Finding problems early means you can fix them. Later might be too late. And being too busy to protect your health means you might not be around to enjoy the things you're busy with. Tomorrow, start by scheduling your first screening appointment. Don't try to do everything at once, but commit to completing all 4 screenings within the next 12 months. Begin with the test that addresses your highest risk factors or the one you've been avoiding longest. Your future self will thank you for taking action during this crucial decade. The difference between comprehensive screening at 65 versus 75 could literally be the difference between thriving in your golden years versus struggling with preventable diseases. If you found value in this information, please take a moment to share in the comments which of these 4 tests you plan to schedule first and what concerns you might have about comprehensive health screening. Your questions help me create content that addresses the real worries people have about taking control of their health. Before you close this video, remember this essential truth. Your 60s are not a time to coast toward retirement thinking about health later. Your 60s are your last best chance to detect and prevent the diseases that could rob you of healthy, independent living in your 70s, 80s, and beyond. Thank you for investing in your health by watching this complete discussion. If you found this video helpful, please give it a like and watch the next video appearing on your screen right now. I've prepared it especially for subscribers who want to continue learning about optimizing their health during this crucial decade. Don't forget to subscribe and ring that notification bell so you never miss content that could add years of healthy living to your life. Your health is your most valuable asset. Protect it while you still can.